All right. Well, I want to start talking about the advanced solutions that we are basically offering. Meridian Health is a HIPAA-compliant distributor of clinical laboratory services. So what we're basically able to do is we provide doctors, physicians, solutions to run a very successful, profitable, and ethical medical practice. So by simply focusing on value, results, helping them lower the costs and increasing revenue. Some of the medical, so basically in a nutshell, we're, so to speak, medical ancillary experts. We're helping the doctors grow their practice and hence their revenues as well. So we really have some great solutions that really helps the patients and helps achieve better patient care for the physician. We offer everything is pretty much non-invasive. So we have non-invasive solutions providing the patients and the physicians with all their needs across specialty areas and through proactive and preventative medicine. So we're really not doing reactive medicine. We're really here to help prevent disease and really help proactively create better patient care. So the rage right now is all about personalized medicine, and therefore we're offering some of the most advanced laboratory testing technologies available. We're using next generation sequencing for oncology. We're using PGX, pharmacogenetic testing. So we're really at the forefront of technology with many of our labs. The big part of what we're able to offer doctors and physicians is that we do not balance bill the patient. So basically, it's all compliant because we're having in-network contracts with the insurance carriers and have preferred rates. We are not we don't need to hunt the patient down for any deductibles. There might be, depending on the lab we're working with, there might be one bill that goes out, but there's no collection process, which usually you can find at LabCorp, Quest, even if you have a $70, $100, payment that is due to them, they will come down and put you into collection. So we don't have to deal with that. So that's a big benefit. And I will go into those kind of details a little bit further in some specific training that we will have on demand available next week, where you can hear directly from laboratory directors that will be available in our training portal. You already received access to that, but I'll go over that later. So one of the two new profit centers that we're able to introduce to the doctors that I'm bringing on board next week is a behavioral health assessment. Basically, a behavioral health assessment is really great for people struggling with depression, have suicidal ideations, people with ADHD or something. So it's a really great program. Also, people dealing in oncology, because so oncologists that have patients that are struggling with depression or ADHD, we can offer them a medical health assessment. It's a great profit center. The physician can make between $75 and $125 per patient by utilizing the test. The test takes about 3 to 4 minutes on an iPad. So they can bill the insurance care by a specific CPC code and therefore really increase their bottom line. It really helps them to retain patients. So rather than helping them sending them out, they're actually getting valuable feedback after the mental health assessment test is done, and really can provide better patient care by taking the patient to the next level, by helping them with their depression or whatever was discovered during that mental health assessment test. It's very easy to implement. Basically, any primary care doctor, psychiatrist, psychologist, or even the social worker can hand out in the waiting room an iPad that will be provided to the physician, and they can take that 3-4 minute health assessment test. It's all secure, it's all protected, it's all HIPAA compliant, and again, it really makes the patient feel comfortable that a doctor takes an extra step, and again, it gives that valuable feedback and information to the doctor to provide, again, better patient care. We're also able to offer a cash pay PGX program. Basically, in a nutshell, many insurances are not paying, or if the patient has a really high deductible, what we're able to do is offer a cash pay solution for the patient. It's a great alternative to the regular PGX testing when there's no insurance coverage. So it's a win-win for the patient, the physicians, and of course our hospital reference lab. Now the pricing is significantly lower, well lower than it would be through a regular PGX test, and therefore it can be paid for by the patient. The physician again can generate at least $50 a test. Now it doesn't sound like a lot, but again it's one of those things where we are able to keep the patient inside the office, where we can provide them an additional test, where we can offer them, you know what, your insurance doesn't cover it, but we're able to run an opioid test to kind of see how you're really metabolizing a certain medication, and patients really like it. Many times the test is about $350, so it can be easily afforded by a lot of patients, and basically has a very broad appeal in cardiology. Pain doctors love it, psychiatrists, urologists, OBGYNs, for, you know, even for pediatricians, for children struggling with ADHD. So it can be done, this test, and help them with their proper medication and dosage. But the big portfolio of services that you will have at your repertoire and going out is our high complexity testing. And what I would like to do now is kind of walk you through some of the actual forms that we will be printing out for you, providing you. You will get access in the portal already through PDF downloadable PDF links, so you can download them as early as today if you like, and start going out and signing up doctor and physician offices. So let me kind of walk you through the process. So basically, we're having a very simple one-page onboarding document. On the top part is the account information, pretty straightforward: the practice name, phone number, the address, and if they request some of the results back via fax, is the fax HIPAA compliant. We go into the contact information, office manager name, the physician's name, the NPI number, very important, the facility NPI number. And whenever you speak or write down the office manager's phone number, it's really important to try to get the back office line, not just the main line, but some kind of direct line to the back office if possible. And then on the startup survey, we're basically just checking off, you know, what is required. Are we looking for toxicology, immunology, chemistry, or PGX, meaning, you know, chemistry is blood. Then we asking them, how do you prefer to get their test results? We are always providing them with a very advanced, sophisticated portal. They might only check fax or email, but we always do have access to the portal, but it just helps us to kind of determine a little bit where they're coming from and what their technological preference is to get the results. A little bit of insight on their practice will be very helpful to kind of see how many patients do they have per month, do they need point of care cups, what's the desired start date, are they ready to roll now, are they ready to roll in 2 weeks from now, do they have a Suboxone program? You know, this form, this lab that I'm suggesting, and I work with several labs, so this is the first set of forms that you will be seeing. I don't want to throw everything at you at once, but this is a very amazing, very high-end lab down here in Florida, and we have a hospital that we're using to reference out to and utilize our billing network through in Chicago. So you can see that on the top of the paperwork. So we're dealing with a lot of you know, treatment centers, and therefore doing a lot of toxicology, but we're really specializing as well in blood chemistry and PGX as well. So then what be really helpful is halfway down on the left side is what's the carrier mix. Get a little bit of a feel for, you know, what do they have, Blue Cross Blue Shield, Humana, Aetna, Cigna, what's the HMO, do they have cash pay? So a little bit of that information would be helpful. Then on the right side, account sample pickup and reporting times. When do they want to have a pickup schedule? So of course, a lot of these details, it's great to put something down. We will always verify. This does not mean that when you check, oh, it's only Monday and Wednesday, and suddenly they need Thursday and Friday. It's of course not a problem. It's always a good problem to have. So the lab will be in direct communications, with the office manager, with the office staff, in order to get that. And then we basically just need a signature, some kind of confirmation from somebody in the office that kind of allows us to kind of reach out to them, speak to them, to make sure that they're on board, that they're understanding that you brought them in. And here on the top of the form, please feel free to kind of write down your name so that we know that this form is also coming from you, that this is an account that you brought on board. There's not any particular filter. You can write it on the bottom as well, on the top. Just your name, maybe Meridian Health would be sufficient for that. So that's a one-page get started form, a one-page startup survey. So very simple process. And I really recommend that you have a few of these handy so that we will make them available digital online. So if you kind of feel like you need to send somebody a follow-up startup survey via email, that can be done that way. But while you're in the office, when you speak to somebody, it would be great to have them right in your portfolio. So this is a typical blood requisition form. We basically see the different panels that are being selected. Again, on the top, basically time, date collected. We see the patient information, the patient signature, and basically the diagnosis code. So again, the lab will speak and educate the office for you. So this is information that does not need to scare you away. I know for many of you guys it might be unfamiliar, seems a little bit very complex, and all these different tests and all these different panels, but you really do not know anything about that. The doctor, they've done this day in and day out, so they're very familiar with it, and we'll talk about the sales process a little bit later. So and then basically they're just filling out this form, they're checking off what panels they need, and then we're good to go. This is our PGX requisition form. Again, basic information on the top, authorized provider ordering below, patient information we have down here on the bottom, the weight and so on. So this needs to be filled out. We have basically two primary choices on the top. Is it a multi-drug sensitivity panel that includes all these different genes, or is it just a general primer? I mean, typically, we want to kind of go with the multi-drug sensitivity panel. It all depends. You would definitely want to advise them to check as many ICD-10 codes as possible. So the doctor definitely wants to make sure that this is being filled out. This is our toxicology requisition form. Again, straightforward, patient information, patient name, and so forth. We have some of the custom panels. With this lab, Spectre Scientific Lab, we're able to provide custom tests. So everything, even on the blood side, we're able to very specifically create custom panels. So this is something that will be discussed once you bring the account on board, once the Get Started survey is filled out. We reach out to them. We get a little bit of an idea what their needs are. They may just start off as us on a trial, test us out with just a couple of tests. But if they are ready to roll, they might want to get a custom panel. They have some specific needs. Maybe they're running a male weight loss panel, female weight loss panel, certain things like that. So we can customize it. We can even put the doctor's name, of course, will be on the form and stuff. So we're really here to take that extra step that you typically don't see from the big guys. For the toxicology part, what's important to understand is that we're able and allowed legally to provide the facility with a standing order. especially if you deal with a drug rehab center or somebody that has a lot of patients that are running through these and do need repeat confirmation testing on toxicology. It's great to have a standing order. It really helps to reduce the time the doctor needs to really physically sign off on each document by having this standing order. So that's pretty much it. And on the right side, you can see it's kind of like we can customize this. This is just like basically where the doctor says, hey, I'm okay to test for all these different drugs to see if the patient is positive or not. Here's, for example, some sample results, the way it's coming back. You see on the right side, everything is negative, negative, and then it's nicely marked and flagged in red when there's a positive results, that's abnormal. And anytime there is any questions from the physician, they can reach out. Phone numbers, fax number, email address is on each form, and they're really encouraged to reach out. And if they have any questions or concerns, that's what our lab technicians are here for. That's what they're trained for, and that again sets us apart in regards of our customer service and quick turnaround time that we are providing. So let's take a look at our sales tools, just to kind of give you, besides the forms, okay, how do we help you as sales reps go out there and kind of close the deal? We understand that making sales, it's difficult enough, especially with a very, very busy doctor's office. And competitors are out there. Everybody's rapidly improving with technology. So what are we able to do? Well, we're providing you with the latest sales tools to really close deal after deal. So let's kind of run through some of these tools. For example, first of all, you will get a corporate email address, which already has been assigned to you. You should have received an email that kind of states to you that your email address has been set up. It's an IMAP email that you can set up on your preferred mobile device. In our membership training portal, there will be a section on Monday where you can kind of go in, click a link, and it walks you through on how to set up your email on an iPhone, on an Android device. Of course, you can also use an online webmail system to check your email anytime and respond correspondingly. We're also able to set you up, and we already gave you access and set up the system for you, an online CRM called HubSpot. HubSpot CRM is very powerful, it's very popular, yet it's very easy to use. We didn't want to complicate things too much, but we did want to give you a tool that actually integrates in the background into a very, very powerful email automation system called Infusionsoft. We're working constantly and for a long, long time on this system, and basically constantly improving it. And basically what happens is that when you insert one of your leads, let's say you're visiting a doctor's office, you can go into your phone, into your Android or iPhone app with HubSpot CRM and type in the information. Depending on the fields, depending on the tag that you can select or a category, let's say it's a new doctor office or it's an oncology, it will then trigger a specific email campaign, specific SMS campaign if there's an SMS, a cell phone number, for example, in the record of that particular practice. So a lot of that follow-up, a lot of that email nurturing is done for you. So it just kind of helps you to not think about that, but really kind of focus on more setting up an appointment, getting that appointment, walking in, presenting the case, making the case that our services are superior, to give us a shot to really help get started with a trial of maybe 1, 2, 3 patients. Maybe they can pick one day a week where they can say, hey, look, for this day, let's just run everything through your lab, and then let's wait a couple of days, let's see how the results are coming in. So if they're a little bit skittish in regards of getting started, that's usually a very good way to kind of get them warmed up to the idea of switching business. We also have a live support system. Our 800 number, which is 877 Test Me Now, we just switched to this brand new number, which will be active in the next couple of days by the beginning of the week. The 877 number is already active. So basically, we're having the highest rated live answering service in the industry that we're utilizing. it's being utilized by billion-dollar companies, and so I don't mind paying the little extra that it costs to have this, but I want to give you the confidence and the support that is needed, that if there is information out there, if there are some potential account going to our website and, for example, finding our 800 number, that they will contact you. When they call the number, somebody will ask them, how can we help you? Your name is in the directory, so somebody asks for your name, it will then directly be transferred to your cell phone. If you do not answer your cell phone, we will take a message for you in person, and the message name, contact name, and what the person wants will be emailed to you, and it will be sent via our text message right then and there. So basically, it's a live answering service that works 24 hours a day. We're also creating your own brand identity. We're providing you with business cards. We're actually already in the middle of the process of preparing the printing. It will be shipped out probably in the next couple of days, by the beginning of the week, directly to your shipping address. I think that was already verified. So as you can see, we have your name on there. It will be sales executive, the 800 number. Once you're out of the trial period, or once you bring in an account, and we really can see that you really are able to achieve the results that we are looking for, we're able to redo the business cards and keep an 800 number, but add your personal extension on there. We will actually provide you with your own iPhone and your own local number at that point in time. So again, something else to look forward to, where we'll provide you an extra phone and to kind of give you the confidence. Your email address is on the card, and our Miami office. We're also opening up an office in New York City in the next probably month or two.